Hi guys, so as most of you already know, I just finished my MS General Surgery and I'm currently studying for my NEET SS. And at the same time, a lot of you are starting off with your post graduation. So, through this video, I'd like to give you 5 tips to make your post graduation better, or tips to help you adjust better to post graduation and also make the best of post graduation. So, firstly, the most important tip, also the most obvious, is never shy away from hard work. Right, post graduation is all about hard work. The more you work, the more you learn. So make sure you're the first to enter the ward and the last to leave the ward. When you start off, this might seem very taxing, very difficult, and might seem impossible, but it gets better with time. So just stick on and make sure you put in the work and go in with the mentality that you're going to work as hard as you can, till you break. The second tip, which a lot of people neglect, is talk to everyone. And by everyone, I don't mean just the teachers and professors and the seniors, but also to the nursing staff who you'll be working with for the next 3 years, and also to your interns who are junior to you. So don't have that ego. Go ahead, talk to interns because they've been in this hospital longer than you. They've worked in this environment longer than you, and they know things better. So talk to your interns, take their advice, take help from them, and get things done. So don't forget, obviously you got to talk to your seniors because they are the ones that teach you and give you the opportunities. Your staff who will help you and make your life so much easier if you have a good rapport with them. And also your interns who, especially in the initial days, will help you understand the working and running of that hospital. And most importantly, something which people neglect is talk to your patients. Right, you come here to become a doctor, to become a better clinician. So talk to your patients, build that rapport. Till now in MBBS and probably even in internship, your main contact with the patient would be transactional. You take their history, or you ask them certain things and then they answer for that. So here is when you start building your career and building your ability to talk to patients. So start talking to patients and be little more than just be transactional. Right, it's not just how are you, this that. So you build a rapport with your patient. They should feel comfortable to talk to you. They should feel comfortable to even visit you later on. So I would also give my phone numbers to them. So that's up to you, but build a good rapport with patients and inculcate that skill and start that right from the beginning of your post graduation. Next, most important, again, just as 1 and 2, 3 is also be patient. It gets better. So when you start off with your post graduation, it's a different lifestyle. Suddenly you have a lot of responsibility. Your seniors and professors are suddenly expecting a lot from you, and then they start scolding you, and then sometimes the environment can get toxic too. And the sheer workload is just so much. You're not used to it. You have to constantly keep working, constantly be in the hospital. Your personal life takes a toss. You don't have any free time. You don't have time to do things you love. So a lot of this, it's a huge lifestyle change. And I would not even say it's a lifestyle change, but it's a lifestyle shock. You go in and then you're just thrown into this very busy, very harsh, very hectic environment. So you start hating it. You start hating the subject. You start hating the environment, and towards the end of it you start hating yourself. Right, it becomes really bad. So remember that it gets better. I would say the first 6 months are the hardest, probably month 3 to month 6 the hardest, because 3 months you can push yourself with motivation, but from the third month to the 6th month it's only discipline and really grit that can take you forward. So the first 6 months, yes, really hard. First 1 year, yes, hard. First 6 months, extra hard. And after 6 months, things start getting better. You make a few friends. You know how the hospital runs. You know how to get work done faster, and you start getting these pockets of free time. So just endure the first 6 months and the first year, and after that things do get better. Especially for surgical branches. Since I did a surgical branch, it really gets fun after 1 year when you start doing independent cases and you really start enjoying it and you start loving surgery. So it starts with you hating the subject, then hating the place and hating yourself, and then it goes ahead to you loving the subject, loving the place, and then also loving yourself. So that's the journey of post graduation. It starts with hatred and ends with love. So just hold on, be patient. It gets better. So don't quit, don't give up, just keep going. Once you clear the first 6 months, life slowly starts getting better, and by the time you're done with your first year, life gets much better. So hold on, keep going. So those are 3 points. Coming to the fourth point, work on your basic skills. So a lot of times we've seen, because of COVID and because of internships not being that rigorous, a lot of people don't have the basic skills such as the Riles tube insertion, Foley insertion, and simple skin suturing. So this first year is the time you work on all of that, right? Every time there's a Riles tube, be present there, put that in. Every time there's a catheterization, be present there, put that in. Become faster, become more proficient, become more sterile in your techniques. So this is time to practice that. And also your dressings. Dressing is key to any surgery. So be faster in your dressings, be able to assess the wound, and all these things are skills. So the more you do, the more you learn. So be available all the time in the hospital, and whenever there's an opportunity to do these basic skills, do them. And as you do them, you become better at them and faster at them. So work on your basic skills, and the first 6 months and probably the whole first year should be dedicated to working on your basic skills, because doing independent surgeries like amputations or appendix or hernia, it comes slowly. It comes towards the end of your post-graduation, or at least towards the middle of your post-graduation. In your first year, the ward, the dressings, wound care, and these basic skills are what you should focus on, and that's all you probably will get. So find happiness in doing that and become good at that. The last and the fifth point is, if you get time to read, and I know in first year it's really difficult to get time to read, but probably you might get some time after the first 6 months. So when you get time to read, instead of reading those large standard books, go for simpler books which are essential and again needed for your basic skills. First one I would recommend is Spice Surgical Handicrafts. Really good book. And it helps you improve your bedside skills and simple basic surgical skills. Bailey and Love to understand the gist of every topic. Obviously, it doesn't have the operative technique and the details required, but it gives you a gist of every topic. So you have an idea, and it's a standard book. You can always quote it. So Bailey and Love is something I would recommend to a first year, and also S. Das for clinical examination and history taking. So once you start getting more time, start taking little more detailed history, little more detailed examination, and keep your Das with you while you do the same. So Spice Surgical Handicrafts, Bailey and Love, and Das. 3 books that I would recommend for a first year. So don't really get into any other book. These 3 would be sufficient. And as you go forward, you can get bigger books like Sabiston, Mango, and whatnot. So these are, if you get time to read these books. So lastly, I'd like to end by saying first year is the hardest year. So just hold on. Probably this is the hardest year of your life. So just hold on, and things get much, much better. And you'll start loving what you're doing as you go forward. So never shy away from hard work. Talk to everyone, be patient, work on basic surgical skills, and read those books if possible. So these are 5 tips that I would like to give you guys. Hopefully you find it of use. And if you do find it of use, you can just leave a comment below. It will make me feel good. So thank you, and see you guys in the next video.